2 questions about blood tests. 1, if your RBC count is normal, does that mean you're not anemic? Most of us have had a blood test at some point. Typically, a certain amount of blood is drawn, placed in a small vial, and then sent to the lab for various analyses. The most common measurements include the counts of red blood cells, RBCS, white blood cells, WBCS, and platelets. If your RBC count is too low, doctors usually diagnose anemia. If your WBC count is too high, they suspect inflammation. And if it's very high, it might indicate leukemia. On the surface, this approach seems completely standard and has been practiced for years. However, upon closer inspection, it raises some questions. Consider how we diagnose anemia. If the RBC count is low, a doctor concludes you're anemic. If it's so low that it threatens your life, a blood transfusion is given as an emergency measure. Essentially, anemia means a lack of total blood volume. But is it really reliable to use just a few milliliters of blood to decide whether someone's entire blood volume is insufficient? This testing method measures the proportion of various components in a specific volume of blood. In other words, it measures their concentration. From a chemistry standpoint, using a concentration value, a qualitative measurement, to determine a total volume, a quantitative conclusion, isn't exactly logical. It's like trying to estimate how many people are in a large plaza by sampling just 100 individuals, finding 60 men and 40 women, then jumping to the conclusion that there are 10,000 people in the plaza. 60 men and 40 women only tells us the ratio. It doesn't reliably project the total number of people. By the same logic, in blood, the total number of RBCs should be the RBC concentration multiplied by the total blood volume. If you treat RBC concentration alone as the total RBC count, you're assuming total blood volume is constant. Yet, to our knowledge, there's no medical literature proving that human blood volume is fixed and unchanging. Western medicine typically demands evidence, but in this case, it seems to have overlooked that principle. In reality, our blood vessels and organs are highly elastic. So common sense would suggest that total blood volume fluctuates. A large portion of blood is plasma, whose main component is water. Thus, if a test shows a low RBC count, one possible explanation is that there's simply more plasma. Conversely, if RBCs are high, it could mean there's less plasma. Perhaps the body is relatively dehydrated. These numbers alone don't necessarily reveal whether the total blood volume is high or low. And for most people, this testing approach doesn't pose a huge issue, since it usually isn't life-threatening. However, in an emergency room setting, these values often determine whether or not a patient needs a blood transfusion. It's possible that some patients are simply low on plasma because their bodies don't absorb water well, driving up the RBC concentration. Even if their overall blood volume is actually low, a high RBC reading might prevent them from receiving a life-saving transfusion. Because blood tests are so fundamental to medical diagnostics, any major flaws here make us wonder about the reliability of other tests as well.
2. How do we know if organ function is improving or getting worse? In daily life, clean water flows in through water pipes and wastewater leaves through sewers, 2 separate streams. People pay a lot of attention to the quality of incoming water, using various methods to improve it, while wastewater is simply allowed to drain away. The biggest difference between our blood circulation and home water systems lies in the word circulation. Our blood is used over and over again in a closed loop, meaning the dirty blood that exits and the clean blood that re-enters are actually from the same source. The arterial blood is clean and has been purified, whereas venous blood is used or dirty. This used blood must pass through the liver and kidneys for detoxification and filtration, and through the lungs to exchange carbon dioxide for fresh oxygen. before it returns to the arteries as clean blood again. When there's an increase in waste products in the blood, there are generally two possibilities. The organs are underperforming, so detoxification is insufficient and waste builds up. The organs are working better, so they're now flushing out more waste from previously neglected parts of the body. Similar to how you'd stir up a lot more dirt if you decided to do a thorough cleaning at home. Imagine a household water pipe that has mineral deposits clinging to its sides. Under normal conditions, the water might still run fairly clear because these deposits remain stuck to the pipe walls. But if you start cleaning or descaling the pipes, you knock those deposits loose and the water turns murky for a while. The human body works in a comparable way. When someone is chronically overworked and their energy is depleted, organ function often declines. The body fails to expel many of the toxins, which end up accumulating in various tissues, leaving only a small fraction circulating in the bloodstream. At that point, blood tests might still show normal ranges. But once the person gets enough rest, their vitality returns and organ function improves, leading the body to clear out all that accumulated waste. As those toxins move through the bloodstream toward the liver or kidneys for elimination, blood test results may suddenly reveal abnormal values. In modern medicine, this is frequently labeled as a sign of illness. So, while it's certain that abnormal results imply something is off health-wise, we cannot be sure whether the body is deteriorating or actually improving its internal cleansing. In other words, a problem in the numbers could be either bad news or a sign of healing. It's risky to assume these abnormal findings always indicate a decline in health. Today's standard approach to chronic disease is to push all lab values back into the normal range. But if these abnormal results happen precisely because organs are finally doing some heavy-duty cleanup, forcing them back to normal might interrupt a beneficial process. Ultimately, this can do more harm than good. Conclusion. From these two issues with blood tests, we can draw a simple conclusion. A major reason many chronic illnesses remain hard to cure may lie in the way we rely on flawed testing methods and then base our treatments on those results. The human body is extraordinarily complex, a biochemical system that behaves like a living factory, continuously adjusting its processes in response to internal and external factors. Understanding lab results not only requires knowing how well the organs function, but also recognizing what adaptive or corrective measures the body is taking at the time. Depending on these adaptive states, the normal range for certain test results may shift. Many testing methods devised in earlier eras, when technology was more limited, may need to be revisited and thoroughly reconsidered. Otherwise, modern medicine could remain stuck in its current predicament indefinitely.